podcast brought to you by Neighborhood Medical Center. I am Joseph Ward, one half of your host, and my co-host is
Mathias Sweet.
right, and we represent the Ryan White program for Neighborhood Medical Center. So if our faces look familiar, good. I mean, we've been doing our jobs. We've been in the neighborhoods in these communities doing a lot for a long time. So today we got a good one today. This lovely young lady that's on the screen right now, she is somebody who's vital to our community here in Tallahassee, especially within our pharmaceutical community and within our HIV community. We've been working with her for about, I want to say over about 5 years, Matthias.
About four.
About four? About four. Okay. Like, I'm gonna give you an extra year. So about 4 years. Um, First met her when she was, I think, was the last of your residency as a pharmacy student coming out of pharmacy school. And I was working at the health department at that time, still partnering with Neighborhood Medical Center. And she's a great asset. She's the first to earn a doctorate in pharmacy and an MBA
At the
From
same
them.
time.
from
Yeah.
FAMU at the same time. So this is Black history right here that we're dealing with. She's a professor at Florida A&M University. She's a stout supporter and advocate in our community for HIV/AIDS and just a lot of the health disparities that go on. So without further ado, we'd like to introduce Dr. Briana Journee.
Thank you so much for having me. Thank you.
No problem. No problem. Thank you for being here with us, Miss Expert.
Oh, and also, Joe, we got to let them know that she knows her stuff because she's a certified HIV
Right,
pharmacist. Am I
right,
correct, Brianna? So
Yeah.
she's
So
one of the few that are in the state of Florida that are certified as a pharmacist in HIV.
right, right,
and
right.
this is
So
the American Academy of HIV Medicine.
so this episode just gonna be stunting on y'all a little bit, just dropping credentials and jewels and stuff. It's all good. But the focus of this podcast today is about Pep and Prep. We know a lot of people know about it or think they know about it. There's a good number of people who don't know about it. We have commercials on TV, have them on YouTube, and a lot of things, but people are not necessarily familiar with what Pep and Prep is. So we're going to dedicate this episode to Pep and Prep. But this is also a follow up from our previous episode where we spoke about HIV/AIDS and kind of broke down what HIV is and the basics of it. So before we move forward in this conversation, we kind of want to reiterate some of the basics of HIV. And so to kind of start with you, Dr. Journee, when it comes to PEP and PrEP and all these different things, um, can you give us like some of the basics of HIV and how that kind of works in the world with PEP and PrEP?
Sure. So you want me to tell you the background of the
Yeah,
virus?
just kind of, yeah, a little
Okay.
background.
So HIV is a virus that attacks our CD4 cells, and our CD4 cells are those cells that are like our fighter cells. That whenever there's a foreign invader that enters our body, those cells go and fight them, pretty much. So when HIV attacks the CD4 cells, it does that so that it can replicate itself in our body. Once it replicates itself, it then kills off the CD4 cell that it just attacked, right? So when we have less CD4 cells, it makes us more prone to not being able to fight off those infections or those different conditions like pneumonia or even the flu, because we don't have those CD4 cells there to help fight off those infections.
Okay. Okay, so no, just quick recap what she's saying. Talking about HIV is a virus that attacks your white blood cells, but also affects your immune system. When your immune system is low, what we call opportunistic infections have a chance to run rapid into your body. And the opportunistic infections are some of the things that mainly cause a lot of the damage and the health issues. So I want to throw this one to Matthias because we Friday at 4:30. We
It's
always
my normal.
we always get somebody coming in the office Friday at 4:30 who needs Pep and Prep. So Matthias, just from a consumer standpoint, um, can you give our audience kind of a background on when you are when you're trying to access Pep and Prep, or when you're trying to get basic information to Pep and Prep, like where can Pep and Prep information or access be found?
It can be found on various websites through the Florida Department of Health, the CDC. You can actually go to Gilead.com and find out about it. You can look up Truvada. You can look up Descovy. All these different websites are there for people. You can go on Neighborhood Medical Center's website and find stuff out. You can go to Bond Community Health Center. All these different resources you have here in Leon County alone are here. People who do provide Pep and Prep in the area is always the Florida Department of Health, the Neighborhood Medical Center, Bond Community Health Center. CarePoint can also assist you in getting to the right location or providing you with the medication. The ER, if it's a dire emergency and it's in the middle of the night, or if it's something that can't wait till in the morning, because most people need to understand that they have 72-hour window period. And so when that exposure happens, you got to get to us. And it's difficult when you come to us at, like Joe said, at 4:30 and we got an hour left to do all this other information, because a lot of it goes into the process when you have no insurance versus you have insurance. Because people don't understand, you need prior authorizations. If you have insurance, we have to find the medication at the pharmacy. That's a big ordeal because some of these medications aren't kept on hand. So just basically having all the information in a row, especially when you come to a provider, we need to know from the time of the exposure, what happened, what kind of exposure, are you really at risk, what's really going on, and we need you to understand that you have to be upfront and honest with us and tell us the truth. There's a no shame, no judgment, no nothing, because this is what we do. But if you don't tell me the truth, I can't help you keep you safe.
Right. And that's go ahead. I'm sorry. Go ahead.
I was just gonna add, I'm not sure where all your listeners are from. So I know you mentioned some places in Leon County, but if you are outside of the state of Florida, because of course the health departments in all 67 counties do offer PrEP for free, but you can go to preplocator.org or pleaseprepme.org, and you put in your zip code, and they pretty much tell you what agencies can help you out. And if you don't have insurance, they have options where you can filter out the results to show what places take patients who don't have insurance. So there are a lot of different resources out there.
Right. And Joe, can we attach some of the resources in the bottom of the bio so that people will know and can actually have like hyperlinks to click on?
Yeah, we will have different links and resources in the show notes for this particular podcast. So now let's go back to the basics about PrEP though. So like, because we're talking about it, and I'm gonna ask it like this because I run across a lot of people who I ask them, have you ever heard of Truvada? They'll be like, oh, that stuff that be on the commercials, and they'll be like, well, yeah, but it's a little deeper than the commercial. So, Dr. Journee, could you break down what Pep and Prep is for?
Of course. So PrEP is pre-exposure prophylaxis, and Pep is post-exposure prophylaxis. So it's in the word pre. So you're taking this medication to prevent yourself from contracting the virus before you've even been in contact with the virus. Post-exposure is you've already been exposed, you already have done that act, and now you are trying to protect yourself. So I always use the analogy of birth control and Plan B. So PrEP is more so like birth control. You're taking it every day before you even maybe think about having sex. You're just taking it every day, right? Indefinitely. And then with PEP, it's like Plan B, where, oh my gosh, oops happened. And at that point, you are trying to protect yourself still. So then you are going to get PEP or post-exposure prophylaxis. But the main difference is that PrEP is just one drug that you take every day indefinitely. It has two components in it, and there are two different brand names for it, but I don't know if this is a branded podcast or if I'm allowed to say brand names. Is it okay?
You can say brand name.
Okay. So there are two different brand names for PrEP. That's Truvada and Descovy that are available currently for PrEP. And then for PEP, it would be one of those agents plus an additional agent. And then the only difference with PEP and like the analogy I use with Plan B is that it's not just one pill that you take once and you're fine. You do have to take it for 4 weeks. And then after that 4 weeks, you need to make sure that you follow up to, ensure that you have not contracted the virus.
Okay. And I like to use the analogy of the birth control pill myself when we're talking about Pep and Prep, because I found that it's helped clients that I talk to really understand how it works, especially a lot of the ladies. When you're giving it to them, like, take this pill, like this Prep. If you are in like an HIV discordant couple, and one person is positive, one person is negative, the negative person needs to be taking Prep.
Definitely.
Now, Prep is also best used in conjunction with condom use.
Yes.
Because we don't want people to just be out here thinking that I can take Pep or Prep and not have to use condoms. And the reason why I say that is because you and I, Briana, we started going around doing these classes and teaching people about Pep and Prep a while ago, like around the time when it first came out. But one of the reasons why it sparked me to do that is listening to people say that, hey, there's a drug out that stops HIV. Like, you can have unprotected sex and it don't help you get HIV at all. So could you two kind of hammer that home, like, this is not the cure drug?
Nothing is 100% effective. Not even birth control. I know people who were on birth control taking it every day and they still got pregnant. So I just want everyone to understand that nothing is 100%. So because nothing is 100%, it is important to make sure that you are practicing safe sex practices,
Right.
and that you're also having those conversations with your partner. So if it is a situation where your partner may be HIV positive and you're negative, they have to do their part too. And they need to take their medication to make sure that they're undetectable, so that they're protecting you. And then you're also taking Prep, so you're protecting yourself. And then the condom also, of course, adds that extra layer of protection.
And if you really want 100% way of staying safe, it's abstinence until you really find out that you're ready to be out here having sex and taking these acts and doing these types of things. The only safe, 100% way is abstinence.
Mm-hmm. Mm-hmm. And make sure you all are having conversations and getting to know people before you have sex and engage in any type of sexual act. Well, trust me, we get it. We done live life, college students and everything. We get how every situation isn't ideal, but you do want to make sure that you have your safe sex materials with you when you're going out, especially if you're going to the club or stuff like that. Hopefully nobody clubbing in the middle of this Rona, but if you're going out, make sure you keep your safe sex stuff in place.
So, Briana, what is the process for accessing Prep and Pep?
Okay, so I'll start with Prep first. With Prep, you need to have a primary care provider or see a health care provider. And you can see that at Neighborhood Medical Center. They have providers. Of course, other federally qualified health centers have them in the city or in the county, Leon County. But if you have your own primary care provider, if you have insurance and you see a private doctor, that's fine as well. You just need to see a healthcare provider is the bottom line. And then from there, they'll perform certain tests. So they'll have to do an HIV test because, of course, they have to make sure that you're negative, because this is for those patients who are negative. They'll also do like an STD panel just to make sure that there's nothing else going on that they need to maybe address. They'll do, like your kidney function. They'll look at different things just to make sure that it's okay for you to start this medication. Once they check you out and everything is good to go, they'll give you a prescription, send it to the pharmacy, and that's pretty much it. And then depending on if you have insurance, of course, there are prior authorizations that have to happen. If you go through the health department and get it for free through them, that's fine. But there still is a paperwork that has to be done and completed. For PEP, like Mathias mentioned, it's a time frame. 72 hours is your time frame. And so that 72 hours is when you need to put the pill in your mouth. That's not when you need to start the process. I just want to make that clear. So if you have sex on a Friday, don't wait until Monday to try to get this situation addressed, okay? Because it is a process. It's not going to just be like, oh, okay, here you need PEP, here's the pill. So it's pretty much the same where you would see a healthcare provider. They would still do those baseline lab tests to make sure there's nothing alarming or there's no reason why you can't start the medication. And then they'll prescribe it. And it's important. Follow-up is really important, especially with PEP. because you take this medication for 4 weeks or a month. And then you need to make sure that you are going back in 4 to 6 weeks to see that provider to, recheck you. You need to make sure that you have not contracted the virus because, of course, like we just mentioned, it's not 100%. So we want to make sure that we follow up 4 to 6 weeks. And then after that 4 to 6 weeks, we still want to make sure that we get another HIV test in about 3 months. So I think that's really, really, really important. Follow up is very, very important. So once you go through the process and you think everything is done, don't think it's done. You still need to go and make sure that, you're still healthy.
Right. I do have a question because you mentioned doing the screening on the kidney function. So what happens if a person's kidneys aren't healthy enough to take the drug? What is the alternative that are used?
So one of the things that they use to measure kidney function is like creatinine clearance. Okay. And so if your creatinine clearance is less than 60, then it is not recommended that you start Truvada for PrEP. However, the FDA just approved Descovy for PrEP, which allows you to begin if your creatinine clearance is less than 30. Is greater than 30. So you have that little window. The only thing with the Descovy is that it's only indicated for men, not women. So if you have vaginal sex, it is not indicated for you at the moment. It does not mean that it won't be in the future, but right now it is not indicated for you. However, there are doctors who will write off-label. They will write prescriptions off-label. And when I say off-label, that means that they will write you a prescription for something that technically is FDA indicated for one thing, but they know it'll treat, the other thing. The only issue with that is when you write off-label, a lot of times insurance companies won't cover medication. So if you have insurance and you're trying to use your insurance to pay for it, they may not cover it because it's not indicated for you. So I think that's the biggest, thing that you need to think about. And so, yeah, that's pretty much it. If your kidney function is extremely low, they probably will not start it on you. And that reason is because there is a risk, when you take anything that, it can decrease your kidney function and that sort of thing. So they just want to make sure that you have healthy kidneys before you begin.
All right, I appreciate that. So, with Pep and Prep, because we talk about it, we're going deep into it, and this is just not for me, but other people who are tuning in. How does it help either stop or reverse or help prevent HIV transmission in the person when taking either Pep or Prep? Because I know, like with the Pep, that's the 72-hour pill. We have to hurry and get this in. But can you explain like how the drug is working with the cells or with the receptors of things and helping to stop things from attaching or whatever?
Sure. So with any virus, it needs a host cell in order to replicate. So that's the key with HIV. It cannot do it on its own. So it needs your CD4 cell to replicate itself. So basically what the medication is doing, it's stopping the viral RNA from transcribing into DNA, which then stops the replication process in your body. So that's the biggest thing. It needs the CD4 cell to replicate. With the medication pretty much stops it in its tracks, so it cannot replicate itself. If it can't replicate itself, it won't go out and infect other cells.
Right. Okay. Sarah, because I ain't gonna lie, that's one of my favorite parts too, cell replication. But go ahead, Mathias.
So, can you I know we have previously said some organizations here in town that actually provide Pep and Prep, but can you list any agencies that you know that are able to provide Pep and Prep for clients?
Yes. So, like I mentioned before, the Department of Health, all 67 counties within the state of Florida offer that for free. Bond Community Health Center is one. Neighborhood Medical Center is going to help you with getting the resources. They may not have it on hand, but they're going to definitely help you get it. Big Ben Cares and CarePoint, that's another agency that can help you get PrEP or PEP. And then also, like I mentioned, if you are not in Leon County and maybe you're, in Central Florida or something like that, and you can't get to a health department, like I mentioned, go to preplocator.org or please prep me.org, and you can find, locations near you that do offer that service.
Okay, I got a spin-off question.
Mhm.
So earlier you said to go to your regular primary care doctor, right?
Mhm.
So, but what if my primary care doctor is against or doesn't feel comfortable writing PEP or PrEP?
So that is possible. Some primary care physicians or nurse practitioners or whatever type of prescribing provider it is, if they are not unfamiliar with HIV care, they may not feel comfortable prescribing that, right? So it's important to just feel empowered to know that you are the patient. And so if they don't feel comfortable, it's important for you to ask questions like, okay, well, if you don't feel comfortable prescribing it for me, who can you recommend? Who can you refer me to? And they should be able to refer you. It's all about feeling empowered. So once someone tells you no, if you are talking to a physician or a doctor and they're telling you no, don't take that no and just say, well, I guess I can't, try to protect myself. There's someone who it should be able to help you. So if you have a primary care physician and they don't want to do it, and then ask them if they can refer you to someone. If they don't refer you to someone, then go back to going to that prep locator and trying to see who in your area can actually give you the service.
Okay, I'm glad you said that, because I was just about to ask, what's the best way to find providers who understand HIV and prescribe PrEP? Because as you were, like, in my mind, or in a lot of people's mind, if you're a doctor, then you automatically know about HIV in a lot of our minds. But basically you're saying that's not necessarily the case. So what's the best way to find out which doctors does kind of either know about it or specialize in it?
So if you go to the American Academy of HIV Medicine, their website is AAHIV.org, I believe, or AAHIVM.org. I can let you know at the end so you can put it in the notes for sure. But if you go to the American Academy of HIV Medicine's website, they do have a directory of um, credentialed physicians as well as nurse practitioners and of course pharmacists. But they have a directory of providers who are credentialed in HIV, and that's what they do. They treat HIV patients. So if your physician or your primary care provider does not feel comfortable treating you when it comes to PrEP and PEP, then that's okay. There are many people who will.
Good. That's good. So when it comes to the taking the medicines, taking the Pep and the Prep, sometimes people can do what they want to do, make up their own rules. But what's the best way to use Pep and Prep to ensure your maximum protection when you're going out? If you're still having an active sex life or whatever, what's the best way to use it to maximize your protection?
So the best way to take any medication is to take it at the same time every day. Okay. So if you know that you have to be to work at 9 and you usually wake up at 7:30, and you have a routine to take a shower and do all these things, make sure that that pill is maybe in your bathroom or sitting on the maybe table right before you leave so that you can take it at the same time every day. I also think it's important to know that, say for instance, if you're rushing, right, and you go to work and you're rushing to work and you're like, oh man, I forgot to take my medication. If you think about it and it's like lunchtime, that's okay. Take the medication still. And then, get back on track the next day. Now, you don't want to obviously, double your dose and take 2 in a day trying to catch up. That's not what you're doing. But you do want to try to make sure that you're taking it every day and try to get it around the same time every day to make sure that it's most effective.
Okay, so what would happen if a person does double their dose or even miss a day taking the pills?
Okay. Well, doubling your dose isn't going to give you extra protection. So I think that's important. Some people think, oh, I'm going to double the dose so I can get extra protection. That's not what it's going to do. It's just going to kind of put you more at risk for the side effects that come with the medication. So it's important to just take one as prescribed. And then if you miss a dose, it's not necessarily that anything is going to happen. It's just going to the medication may not reach therapeutic levels where you need it to where you're having that maximum protection. When you continuously miss doses, you're not necessarily getting to that therapeutic level.
Okay. So as you know, most of the population that a lot of us deal with are uninsured or underinsured.
Mm-hmm.
And even for some of the insurance, the copay for the medication is kind of like a two-part question. The copay for the medication can be kind of expensive. because we know as healthcare providers, the drugs are expensive. So first part of the question is, what is the average cost of taking PrEP? You could probably do it per year versus per month. I think that might be a better estimate. Or
well, per month is so Truvada, for example, is about $2,000 a month. If you don't have insurance, you don't have any type of assistance, about $2,000 for a bottle. Okay, and you're taking a bottle every month. Okay, so obviously, when you get into other brand names, it may have different prices depending on how new it is. But at minimum, you could probably expect about $2,000 a month. Now, with insurance, it all depends on your copay. Depending on, if you have some type of co-insurance where they make you meet, some insurances you have to hit a certain level before they are going to basically continue to pay for all of the medication. And then, wait, what was your second part of the question? I'm sorry.
the second part of the question is, how can they access it if they don't have the funding for it? So,
Okay.
like, if I have no insurance and I need PEP or PrEP, how can I get it paid for if I have no money? Or if I have insurance, how can I get that copay covered without having to pay for it?
So manufacturers of the medication have really good assistance programs. So for PrEP, it's Truvada and Descovy. That's Gilead. So what you would do is you would go through the manufacturer and try to see if they have some type of assistance program that will assist you with the copays if you have insurance, or if you don't have insurance, they may be able to get you in their program where they just ship it out to you directly from the manufacturer. I mentioned before, the Florida Department of Health is completely free. So you don't have to worry about a copay at the Florida Department of Health. Depending on why you're taking PEP. So for example, if you may see on, different ads, you may see a small letter like N, it'll say NPEP or OPEP. So NPEP is non-occupational, OPEP is occupational. Meaning that you were exposed at your job. So maybe if you're a nurse or you work at a hospital and you may have been exposed to a needle prick, then you have occupational exposure. So in that situation, it should be covered by your workplace, workers' comp or something like that. Now, if it's NPEP, which is non-occupational, and you just got it, out, doing whatever it is that you may do. But if you, may have been sexually assaulted, so, there's ways that you can get reimbursed through Department of Justice for for that medication. Of course, when you get reimbursed, you have to pay for it first in order to get your money back. So, I mean, it doesn't help if you don't have the money in the first place. But I really do recommend going through the patient assistance program through the manufacturer. Usually they are there to help you.
And also with that, a lot of the agencies will assist you with that process. So you're not alone in that, because it's a very not difficult, but it's a tedious process.
Yes.
That they're going to ask for a lot of stuff. And you have to send stuff over right now, do things like that. So I can only speak for neighborhood. Right now, at neighborhood, we actually assist you with that whole process.
Mhm.
So we don't want you to feel like, okay, oh God, I need this, because you call the drug manufacturer, you don't have a prescription, you're still going to be out of luck, because you need the prescription to go with everything, to go with each piece of the medication. So we really want you to understand that we're here to help you. We're not here to just throw you out there. We look at our clients as almost like family, because you're
Right.
part of the family. When you go to a healthcare provider, I'm here to help you. I'm here to assist you with what you need. So we are here to assist you and help you in those processes to make sure that you get everything in a timely manner and effectively for your treatment in healthcare.
Yeah, and it's definitely a team effort as far as when the client comes in and the client needs PEP or PrEP. It's a team effort, because we like the Ninja Turtles. We just jump on everybody, do their part. But when it comes to PEP and PrEP, and we kind of talked about it a bit, but let's kind of go in a bit deeper. Does PEP and PrEP like really help to stop the transmission of HIV? That's is either one of those drugs designed to just stop it?
So when you say stop it, what do you mean? Like,
to not allow the transmission of HIV from one person to the next. Either one of those drugs are specifically designed to not allow the transmission to happen.
Well, if you look at like clinical trials, so again, this goes back to taking it every day at the same time every day to make sure that there's a therapeutic amount in your blood. So if you look at the clinical trials that they did for prevention, treatment is prevention, you'll see that when they actually did blood tests on the people in the trial to see if the drug was at therapeutic levels, it stopped them from contracting the virus by over 90%. So yes, it does work. It definitely works. In order for a drug to get approved by the FDA, it has to go through clinical trials to prove what it's basically saying it does. And so they have done a lot of studies to show that, yes, it does stop the prevention of HIV. The prevention of and spread of HIV when taken as prescribed.
Okay.
So I got a question, Joe. So it prevents from HIV, but what about other STDs? Because people say that they basically, I got this pill, it prevents me from HIV. So is it protecting me from gonorrhea, chlamydia, syphilis, HPV,
No.
HSV?
The short answer is no. And so I think it's really important. And I'm really glad you brought that up because a lot of people, they'll go and they'll come to you guys and get HIV tested and they're like, oh, I'm good. I'm clean.
Yeah.
I don't have HIV, but it's like, did you get tested for everything else? So it is important. And I'm really glad you brought that up. HIV testing is super important. Yes, you should get tested for HIV, but you need to also make sure that you're being tested for those other STDs, chlamydia, gonorrhea, syphilis, herpes, HPV, like you mentioned. So no, it does not protect you against any of those STDs. And that's why condom use is so important. Because you can be having sex and protecting yourself from HIV, but then you come back and you have something else. So definitely continue to use condoms and other safe sex practices.
And also, I just have to say this part. When you go to your healthcare provider and you're going to get an STD test, please be open and honest with them and tell them what type of sex you're having. You need to make sure you let them know if you're having anal sex, if you're having oral sex without condoms, if you're having penile or vaginal sex, because each different orifice is a different place we have to test to see if you have it. Yes, you can get an STD in your throat, your rectum, and your penis and your vagina. We really want y'all to understand that. But if you don't tell us, we test in the wrong area, and that's how people still spread STDs because they don't know if I'm just giving head that I'm not have to worry about an STD. But you're giving head to the other. When you're giving head, you're passing on the STD because it could be in your throat.
Yes.
So we really want you to understand that.
Yes, because you can have chlamydia. I'm just using chlamydia as an example, and they can test, test your vaginal area. But what if it's in your anus? So you can have a negative test and think you have a clean bill of health, but the whole time you had chlamydia and it was technically in your anus. So it is very, very important for you to be honest. At the end of the day, healthcare professionals are just that. They should be professional. And trust me, when you tell us something, it's not something that we've never heard before. We've probably heard way worse than what you are going to come in here and tell us. So I don't ever want anyone to feel embarrassed or like they can't be honest because, whatever type of sex you're having, at the end of the day, if you are having that type of sex, you are an adult. You should be grown enough to have a mature conversation with a healthcare provider or someone who's really trying to help you in whatever it is that you're doing. So yes, please be honest because, at the end of the day, what are they going to do to you once they find out that you are having? Once they find out that you're having sex, they're not going to
finger at you.
Right? Are you your own? And I'm going to take your phone away. That's not how it works. They're going to now be able to treat you better and understand exactly what they need to do as their next steps.
Cool. So I get this question a lot, and a lot of times it's from heterosexual men, because if you look at the PrEP commercials, it seems like a specific population is targeted. So, is there a specific population that's targeted with either Pep or PrEP, and who is eligible for Pep and Prep? I would say that.
So I can understand why people think a certain population is targeted based on ads because majority of the people that you do see in ads are probably, same gender loving men. Okay. So I think it's important to understand why. The reason why is because if you look at statistics, they are the most at risk. That's the honest answer. They are the most at risk. So yes, they are targeted. However, PrEP and PEP is for everyone, including heterosexual women. A lot of people think, especially women, they assume because they're heterosexual women and they aren't, it, they don't think that they're having sexual intercourse with men who are having sex with men, but technically they don't know for sure. But they think that they're safe, but it's important to understand that African American women, we are, after you get the men who have sex with men, African American men who have sex with men, and then the Hispanic men who have sex with men, African American women are right pretty much beneath the men who have sex with men out of all other demographics. So it's really important that we know that so that we can protect ourselves. And we understand that it's not just for those same gender loving men. It's for everyone. Because at the end of the day, we are all at risk. When we have unprotected sex with people and we may not know everything that they've done, that people are not honest sometimes. So it's important to just treat everyone as though you may think that they have HIV. And when I say that, I mean, don't stigmatize it, but just protect yourself against HIV from whoever you're having sex with. Okay. There are people who come into the clinic and they've been in relationships for years and they come and they find out that they're HIV positive. So clearly someone was dishonest in the situation, but, had you took the proper precautions, had those conversations, then, there's a possibility that that person could have protected themselves.
Right.
So I got a question. So when you're saying conversations, what type of conversations are people needing to have with each other to better help them understand like PEP and PrEP? Is that a conversation you need to ask, or because from my experience with the community and just talking to patients, a lot of them don't have that conversation saying, when was your last STD test? When was your last HIV test? It's they meet up on an app or they meet up on a dating site or they meet up somewhere at the club or something, and then they find out questions after from the street committee, as you per se say. So, what will be some of the conversations that they need to start having, or some type of questions to kick off a conversation if you're really not knowledgeable about how to have a conversation without offending somebody?
Right. So if you don't want to just come out and say, when is your last HIV test without offending someone, a good idea would be like, hey, I usually get tested every 3 months. My 3 months is coming up. You want to go get tested with me? That can kind of ease you into the conversation. And then based off their answer, you can kind of see if there's hesitancy, then you can ask, well, why are you hesitant to go get tested? I won't be in the room while you're getting tested. It's still privacy. So that person, when they go get tested, if you go get tested with someone, it's not like you guys are both in the room together and they're telling all your business. It's not like that. But it is important that you guys are knowing each other's statuses and having a conversation of, how many people are you having sex with? Because if you're not in a monogamous relationship, if you're not married, there's a possibility that you guys are having sex with other people. So just be honest. How many people are you having sex with in the last 3 months? How many people have you had sex with? Was any of it unprotected? Do you if they talk about having unprotected sex with you, then I feel like the conversation is really warranted. Like, okay, let's go and get tested together. If you don't like condoms, if you're allergic to latex, even though they make non-latex condoms, people give you a lot of excuses. But if they give you those excuses, you should be able to combat those excuses with solutions. Okay, let's go get tested together. Let's make sure that each of us have a clean bill of health. Let's have an understanding that we will not be having sex with anyone else. You just need to have those conversations. If you're old enough to have sex, you are old enough to communicate and have those uncomfortable conversations. And why are they uncomfortable if you're actually having sex? They shouldn't be uncomfortable.
But that's what I am, and I'm not okay. And I realize I'm a little more straightforward and brash than a lot of other people. And the thing is, but like you said, if I'm going to let you do something sexual to me, stick something in me or whatever, why can't I ask you these questions? So you're okay with me doing this to you, but I can't ask you these questions.
Exactly.
You have to get to that point of being comfortable, but also I want people to understand, like especially with us three and a lot of the people that you would see us working with, we're real humans as well. We're regular human beings. We've been to college. We've had fun. And we're professionals in this public health realm who is taking all of the knowledge that we know and all of our experiences and tying them up to go out and be the best that we can be as far as preventing these diseases from people contracting these diseases. And I'm saying that because a lot of people look at us as if we are robots or we're people who we don't do these things or we don't do that thing. We look, I was in the moon. If you can tell that, I'd have been in the moon too. I done some wild stuff too. But the thing is, we're regular human beings with real experiences who are not judging anybody because we probably done. I know me. I just put it on me. Probably done worse. But it's we're taking our experiences and making sure that we give you the best care as possible. So if you see one of us, you can talk to us. We can help you, and that's the main reason why we have this podcast and we have Dr. Journee on, so you can put a face to the name, or you can hear the information come out of our mouths. And we are here to help you all. This is our community. We're not going to let our community just go by the wayside. But we are human beings, and we do understand everybody's situation ain't the same. Some people may be using sex as a coping method. Some people, sex might just be I was bored or whatever. So we get those different things that will lead people into doing what they're doing. But we also want to let you know that there are a lot of safe sex alternatives and safe sex resources available for you.
Definitely, especially and I hear people talk about condoms and having to go buy them, and that's expensive. But since I've lived in Tallahassee, I've been here, not to age myself, but I've been here for about 10 years. And since I've lived in Tallahassee, I have never understood how condoms are still stocked in stores and they haven't like stopped shipping here, because Tallahassee literally offers free condoms everywhere. Outside of the Department of Health, even if you don't feel comfortable walking in the Department of Health, where I go get my nails done, I see a little basket with condoms in it. Barber shops, I know Joe and Mathias definitely are good for putting them in those places. Barber shops, hair salons, nail salons. So there's really no excuse. If you don't have the money to buy condoms, you can get them for free, completely free. And they don't even count them off to you. They let you take as many as you want. And so I think it's like you have to stop making those excuses and stop saying that you're like loyal to a condom brand. So that's a big thing. Like, why are you loyal to a condom brand? First of all, majority the people who make the brands that you're loyal to probably make other condoms as well that you don't want to use. So just understand that they are pretty much all the same. They're going to all pretty much do the same thing. And you can say that, maybe you're more well endowed. They make other brands for people who are well endowed. Right. He just showed a full bag. So I just want you guys to get out of that mindset of, oh, well, they don't have the condoms I want in here because somebody else took them all. So now I can't use a condom. Like, no, absolutely not. And if you ask your female partner, I'm pretty sure that your favorite brand is not her favorite brand. I can tell you that now. A lot of women don't like some of the more popular brands because they have stronger smells. They're thicker. There's a lot of things that it can do to us down there. So I would definitely have that conversation and stop thinking that, oh, I have to have this brand for an image. And y'all know what brand I'm talking about. I'm not going to give them no free publicity, but definitely just understand that. Stop making excuses. All condoms are pretty effective. So, and they're free.
Right. And I'm glad you said that. And we had a young lady come in a couple of weeks ago, and she just saying that made me think about her. But ladies, I don't care how endowed he is, there are condoms that fit that. Like we talking about latex is a flexible, stretchable material. If I can put it on, I can put a condom on my wrist, on my hand, to throw up gang signs with my hand in the condom. I can put the condom on my head and put it on my foot. There is no penis that's too big. There's
and
no
if you
such
have
thing.
an allergy, they make non-latex condoms, which I personally prefer. And I don't have latex allergies. But if you have latex allergies, they do make other types of condoms that are just as effective and, work just as great.
Right. The non-latex one is,
yeah, it's our favorites. So, but now, I mean, this is great because we're having a chance to make sure that we give people the information that they probably would have to wait to go to a class or go to a seminar. That's why I'm glad we started this podcast, and I'm grateful for you, Dr. Journee, for coming on and kicking it with us. Because you already know we're gonna have to bring you back.
Of course. Look, I love talking to y'all. I love
Right.
kicking with y'all. So definitely.
Right. So how can people get in contact with you? Somebody want to book you for an interview, they want to pay you to talk about something. How can people get in contact?
Well, no. For booking, no, I'm joking. You can email me. My work email is Briana, my first name, Briana, dot. My last name is Journee, Journee, at FAMU.edu. And of course, I will respond timely.
Any last words you got, Mathias?
Nope, I just really hope everybody, really took heed to what we said today about Pep and Prep. My real takeaway moments is don't feel ashamed. Just really just come out and if you need the help, we're here to help you. Just come out, ask the questions. Don't be scared. There's never a dumb question. There's nothing that, if we don't know the answer to, we'll find it for you to make sure that we can assist you with it. But the takeaway thing is just to make sure that if you do need Pep and Prep, we're here for you. Please use condoms effectively. Huh?
No, I was going to say something.
And just make sure that, that you take care of you. We always try to take care of everybody else, but we need to remember that we got to take care of ourselves as well. And so sometimes we as healthcare professionals are the worst ones because we don't really take care of ourselves, but we need to. So with that, just basically, if you need Pep and Prep, come holler at us. Come let us know. We out here in the community to help. You'll find us at Neighborhood Medical Center, or you can reach us at our website at neighborhoodmedicalcenter.org. We'll put our contact information below with the other health resources. But just stay protected and just tune in next time, and we'll be here with another topic for you. And again, Miss Briana Journee, we thank you for coming out and being a part of our podcast with us.
Thank you. And I was going to just say one more thing. I'm sorry. In addition to what Mathias just said, I want everyone to be empowered to take control of your health. So if you go and if you have questions about anything, you should feel comfortable and empowered to ask your primary care doctor. And if they are giving you some type of vibe that they don't want to help you, then that should be a sign to you that that isn't your primary care provider. That's not the primary care provider for you. So it may be time for you to find a new one, but feel empowered. Definitely feel empowered.
Right. Your primary care provider works for you. So with that being said, this is Mind Your Body and Soul, the Healthy Podcast. Remember, you can view us on our website, www.neighborhoodmedicalcenter.org, as well as our Neighborhood Medical Center YouTube channel. And the audio is available on all your favorite podcast outlets. So with that being said, I am Joseph Ward. He is Mathias Sweet, the lovely Dr. Briana Journee. See y'all next time. Peace out.